So, Julie Joe, you said I should talk about bone marrow transplant for sickle cell disease adult. Now, bone marrow transplant is a process where we replace unhealthy, diseased, defective blood-forming cells with healthy ones. And there are different types of bone marrow transplant based on the source now, the donor. So we have the autologous. The autologous is that we get the stem cells from the patient at an earlier age or when the person was younger, when the cells were healthy, and store them. Then we transplant them or give them to the patient at a later time. That's autologous. There's allogenic or allogeneic. So that allogenic, we look for a relative or someone that matches the patient that we're going to give the recipient now. It can be a family member, it can be a matching donor. And under that category, there's what we call haplo-identical. So pseudo-identical, like halfway identical. This haplo-identical, we look for someone that has the closest match, maybe half matching because of the need, because of the load. Just give it to that person. It can be from a family member, it can be from a donor. We have the syngeneic, SYN. So this one is from an identical twin. So this is usually the best match. So an identical twin will be the donor. And we take the stem cells. The stem cells are cells that have not decided what they want to be in life. They've not decided their future path. So we take them and give them to that patient. And we usually see a good result. Now, the procedure itself can take maybe 2 hours. But the workup, the searching for donor, the HLA matching and all those things can take several weeks to several months. So when I say HLA, HLA is human leukocyte antigen. That is on the cell surface. There are certain receptors, certain factors that are there that match. And this is important so that you don't give this cell to a person and the body now rejects it based on the cross-matching or the mismatching of those surface cells. So what is the procedure? The first step in the procedure is preparation. So this one, we do a conditioning. We use relatively low intensity chemotherapy or radiotherapy to kill off the cancerous, the defective cells, the problematic cells. One, to remove as much troublesome cells as we can. And two, to make sure there's enough space for the new cells coming in. This one can take weeks. So we give them some time to allow the chemotherapy tick or the radiotherapy work. The next step is the infusion itself. This is just like giving blood transfusion. So we use a catheter to pass blood into the person's veins. These cells will pass into the veins, and these cells will find their way in the bloodstream to where they're supposed to sit and function and start producing the normal cells. The third step is the engraftment. That is, these cells, they will find their way, these stem cells that we introduce into the bloodstream, they will find their way to the bone marrow and start producing healthy cells from there. And with that, we have successfully begun to reverse the process of sickle cell disease or whatever disease we are trying to treat. Now, this is not, the way I explained it is not quick. It takes a while. It may take weeks. So what are the uses? The first one is blood disorders. So we have sickle cell disease, sickle cell anemia, we have thalassemia, we have aplastic anemia, we have the lymphomas. Also in blood disorders, we have cancers, lymphocytic, lymphoblastic, myeloblastic, all those big names. Leukemias, you use it for it. Then for people that have immune problems, you can also give stem cells or bone marrow transplant for people that have immunity problems. Just like every procedure, there may be some side effects. These side effects may be immediate and may be long-term. So the immediate one can include fatigue, nausea, fever. And the long-term ones will include infections. Infections because you have reduced the immunity so that you can introduce new cells. And also graft versus host disease. This one is quite important because, for instance, in the haplo identical, if there's a reaction, if the body of the recipient sees that stem cell that you're introducing as a foreign body, it will attack it. So we'll say the graft has been rejected by the host. So graft versus host disease. That means that your procedure has failed. Why we have successfully done, imagine, let's just assume that we have successfully done the bone marrow transplant. It's a long process and it's usually emotionally and physically challenging. And as an African, I will tell you, financially challenging too. So these are the things you prepare for before, during, and after the procedure. So in 2025, 2026, there's a lot of great news in that field. We have success rates of up to 95% of bone marrow transplant for sickle cell disease patients in adults. And it's even a better option than gene therapy. According to Johns Hopkins University, their research team found that it's better than gene therapy. Who are the people, who are the adults, who are the people that will say, look, the option for you is bone marrow transplant? Number one, people that have had more than 3 severe pain crises. For the sickle cell disease patients, you know what crises are? More than 3 in the last 2 years. We say, look, this is the best option for you. And we look at people that we say, look, in 2 years, when we are taking note, in 2 years, people that have had 2 or more episodes of acute chest syndrome, we talked about angina before, stroke of the heart. So people that have had acute chest syndrome, more than 2 in a period of 2 years, any 2 years you look at, they're also candidates for bone marrow transplant for sickle cell disease. And of course, because stroke is a complication of sickle cell disease because of clot, if you have had a stroke before, even if it's a silent stroke, it's an indication, it's a recommendation for you to have bone marrow transplant. Bone marrow transplant is a cure for sickle cell disease. In fact, it's a very effective cure for sickle cell disease. And while it's effective, even after going through all the process and everything and it's successful, it does not reverse the damage that has already been done before the bone marrow transplant. For instance, if you had stroke before, if you had deep venous thrombosis before, if you had clot somewhere before, if you had enlargement of your spleen, if you had ulcers as a result of sickle cell disease, some of these complications, it's not that the bone marrow transplant will now reverse it, no. It remains there, but subsequently, there will be no crisis, there will be less crisis. Your fatigue episodes will reduce. The problems that you have as complications and symptoms of sickle cell disease, the anemias, the jaundice will reduce. Looking at the costs, looking at the procedure, looking at the person that is going to practice, going to do the surgery for you. Discuss everything from beginning of the procedure to the end with your health practitioner, so that you are well informed, you are well carried along, and your support system is on standby. That is your family, your friend, your sponsor, your spouse. I've talked about bone marrow transplants. I hope this helps. I'll see you at the next one. Bye-bye.